Hi, okay, we are back for our last trail of the shoulder. We're going to do the two hills in the valley. This one will be very clinically relevant for you as you are gaining more and more experience with your patients, that they're going to have a lot of that impingement type syndrome, especially with our posture these days where we're forward. We start to close down in on those anterior structures of our shoulder. So today we're going to actually find the bicipital groove first, actually, or also known as an intertubercular groove. Is that right, Dr. K?
Intertubercular groove.
There we go. She says it a little bit better than I do. So we both clinically feel like one of the best ways to find that, and what's nice about the groove is your hills are the lesser tubercle and then the greater tubercle. So we actually both agree that if you come into just a little bit of external rotation, that you can actually see very nicely on Dr. K that she has this little groove right here. So if you feel in there and you resist a little bit of that isometric biceps contraction, or as you ask her to internally and externally rotate, underneath your finger you should feel movement of the tendon as it passes into that groove. If you open up into a little bit of external rotation, it's a little bit easier to just slide off of that, and now you're going to get onto the lesser tubercle. We also want to palpate the greater tubercle. So if you slide over to the greater tubercle, you're going to feel that the greater tubercle is actually a little bit more posterior. And it's also, if we find our bony landmark of the acromion, it's inferior to the acromion process as well. Greater tubercle is very important because it houses 3 of our 4 rotator cuff attachment sites. So pretty important for that stability and mobility of the shoulder as we ask it to go through a lot of different ranges of motion.